Laser vaginal rejuvenation is an increasing popular treatment for vagina tightening and bladder dysfunction, vaginal atrophy and vaginal dryness. And more ladies, they are keen for a non-invasive procedure in order to maintain a good function in the area. In our clinic, we have the Fotona Laser, that is EBU-YAR laser, is proven absolutely safe in multiple clinical studies. Many women undergo significant events in their life, so that sometimes means childbirth trauma, or that can be later in life, like perimenopausal period and menopausal period that has as a result vaginal dryness and vaginal laxity. Or rare cases of hormonal related cancers, when we have to take some anti-hormone treatment for a period of time, so we suffer that period from dry vagina or from reduced libido. So we have to offer multiple treatments in our clinic with the Fotona Laser. First of all is the Intima-Lace that helps with the vaginal laxity syndrome, is what we call loose vagina. So what it does, it is causing a control thermal effect on the vaginal tissue and stimulates the collagen genesis. Helps all the muscles and the collagen fibers in the area to rejuvenate. So we have very good results, increasing sexual satisfaction and maybe stronger orgasms. I have personally noticed that ladies that they complain of producing too much vaginal fluid during sexual intercourse, somehow Fotona Laser helps to regulate the glands. So people that are producing too much fluid during sexual intercourse, they have as a result less fluids and less friction and satisfaction during sexual intercourse. People they suffer from vaginal dryness helps them to produce more fluids during sexual intercourse. So it is really helping a lot in order to achieve a nice sexual and healthy life. We also have the treatment called prolapse, so that is if we have a degree of prolapse. Sometimes after childbirth, we suffer from either bladder wall prolapse, so that means the bladder is full inside the vagina, or rectal prolapse, when the bowel is full inside the vagina. So with this treatment, we help again all the tissue and the muscles supporting the structures in the right place. And so we have again very good results in helping with the prolapse itself. That means that sometimes ladies complain of a dry sensation or a lump sensation, or even discomfort during sexual intercourse. They come back to us and they report, yes, I feel much better with this feeling, as well as they have less of the symptoms of incontinence. Stress incontinence, means incontinence, either urine or rarely can happen with stools as well. We also have a treatment for vaginal atrophy and vaginal dryness, that is for menopausal ladies. So the energy is slightly lower for them because the tissues are slightly weak. Again, during the examination, I assess the quality of the tissue and they apply the right energy. It depends on the strength and the quality. So with the Fotona, first of all, we introduce a glass speculum in the vagina. And we change a few different probes, usually 3. So we have this probe that we introduced the laser probe inside the glass speculum, and then all of that goes inside the vagina. And that little probe focuses either on the anterior or the posterior wall of the vagina. So if a lady suffers from a bladder prolapse, let's say, then we focus on the anterior wall. If a lady suffers from a rectal prolapse, then we focus on the posterior wall. So this is the probe that we use at the end of every single treatment, and this is actually to apply energy on the tissue around the vagina entrance, as well as to the labia majora and the labia minora. And altogether the procedure takes approximately 45 minutes to 1 hour. It is a well-tolerated procedure. We don't need to have any general anesthesia or any local anesthetic cream or injections. You feel after the procedure absolutely no pain and no discomfort. There is no downtime for any of the treatments with Fotona Laser. The only recommendation is to avoid any other type of electricity in the area for the next week or so. Let's say if somebody is doing hair laser removal, then we suggest that we should not have any other type of energy in the area for the next week.